So far, we've spent a total of about $7,000. We've had over 1,151 conversions, over 1,000 new patient phone calls or form fill leads, and his cost per conversion from Google is $6.12. $6.12 for a new patient phone call. So we'll go back to the questions here and go ahead and share with them the results you had from that total ad spend. How much revenue do you think you made during the pandemic?
Dude, so April, once the emergency stuff started hitting, like first week of April, because we started talking end of March and first week of April, we went live with it. We did 437 that month, right? Insane. And then last month, May, we did 610. COVID, right? And this is all from extractions and root canals, or starting root canals, right? And extractions, right? And now those patients are coming back. Restrictions were lifted. This month we're so far, and it's only today's the 17th. Dude, I forgot what day it is. 16th or 17th.
17th, yeah.
We're at 532 or something like that. So insane, dude. It's just phenomenal. And all the patients who we treated during those times, they're coming back. They're like, I've never been treated this way.
Hey everyone, this is Keanu from Value Driven Ads. We're on the Client Success Interview Show where we interview our top performing clients that are using our marketing programs. And today I have a very special client with us. He's an absolute beast of a dentist, great businessman, Dr. Jigar Gandhi out in North Massapequa, New York. How you doing today, man?
Doing great, man. Just had a good day today, man. So still crushing it, man. Just enjoying myself, man. So it's having a good time.
Good. You see a lot of patients today?
Oh, dude, we saw quite a bit of new patients. Fewer from you, even though we didn't start. Yeah, a few came in with the internet leads. Yeah, definitely, man. I had a $37,000 day, so not bad.
Excellent. Love to hear that. Love to hear that. So can you share a little bit about your dental practice with the audience? I know that you are definitely not the average dentist. You are very much a 10Xer. You like to go at it. Share a little bit about the business, the employees, revenue numbers, things like that.
Yeah, so I have one other dentist with me right now, so it's me and one other associate. I have 3 full-time hygienists, 4 dental assistants now, and then the rest, about 7 other personnel, front-end personnel, and treatment coordinators, and my wife, who's the office manager. To tell you guys how we started out, we started at 1.1 million about in 2015. That's where I bought the practice. And now last year we did 6 million. So yeah, we're just cruising right along, and every year just adding more to revenue, looking for more dentists. I basically zoned in on 2 more associates to hire them, and they'll start somewhere in August. So yeah, just even though I don't have that many personnel, we're a tight-knit group, well-trained, know what we're trying to accomplish here. Dentistry-wise, we do everything. All the restorative, all the surgery here, the things we refer out are anything with IV sedation or wisdom teeth. But other than that, we handle majority of cases here from start to finish.
Amazing. Amazing. So from 1.1 to 6 million revenue. Obviously,
it's been hard work.
Yeah,
dude, it's been hard work, but the last 5 years have been, fun at the same time. It definitely has changed our perspective on dentistry. And the amount of patients we're able to help. We have patients coming in from all over Long Island now. Even, I don't know. I think people are coming from New Jersey, Delaware, Texas. So it's Florida, so it's great, just enjoying it. Name's getting out there, so it's like, hey, everyone, come on board. I don't care. We treat everybody the same way, so it's fun.
Great. So obviously, these are difficult times due to COVID-19. The last few months, a lot of dental offices were shut down, but things were a little different in your practice. You had a lot of volume coming in. Let's not talk about that with the marketing and how we pulled that off, but can you share with me some of the challenges you initially faced when you heard about COVID, impacting dental offices?
Dude, as soon as I'm in New York State, and Long Island, so we were hit hard, especially with the shutdown. So the 3rd week of March came and we just went, March was supposed to be our best month ever. We started out strong, and then all this stuff started coming out, and my schedule, everything just bombed. No one wanted to come in, no one wanted to do any dentistry, and I get it. It's all this stuff is going on the outside, so that takes priority. But and it was like it. It came down total shutdown, dude. And
we were doing implant marketing, right? We were doing implant marketing to that point,
yeah.
and then these things we had to
Oh,
pivot.
dude, yeah, dude. The cases I was doing, I mean, I was away like from January to, and you guys see these stats. I'll show you them. I gotta sit down and show you them one day and screenshot them. But January to third week of March, so you have 4 weeks there, 4 weeks. So you're talking about let's just say 12 weeks. Yep. Out of those 12 weeks, I wasn't present in my office for 3.5. So you just take about 8 weeks. In those 8 weeks, the amount we produced in the first 3 months was insane, dude. We did 550. So we did about, what is it, 1.6 million or 1.65 million the first 3 months. Yep. So you got to talk about it. It was just skyrocketed. We had so many because of your marketing, because of implant marketing, we had so many patients coming in, and it wasn't just implant marketing. Like, you do that part, but then patients are coming in for Invisalign from the implant marketing. Because they're like, well, we like this guy. If he does Invisalign, we just want to go see him too. And they Google, they do all their research and all that stuff. So it was just jam-packed, dude. And the crazy part was when COVID hit, the patients were like, okay, we don't want to come in now. Can we come in April? And then April had to get canceled. And then May. Can we not come in May? Can we come in June? So those leads that you still generated from back then are now finally coming in, and we're getting the work done.
Excellent.
So,
excellent. Yeah. Awesome. So can you share with them a little bit how we pivoted, right? So we were working together on implants. We as a company, Value Driven Ads, we knew that we just saw the writing on the wall. We had to heavily pivot everyone, and we decided to do something that was a little bit different, right? We shifted over into emergency dental marketing for you. And initially, I think you were concerned about the cost because historically, Google Ads in New York, really anywhere in the state, you're spending like $7, $15 cost per click. But what were the results you had with our emergency dental marketing? Can you describe production, calls, things like that?
I mean, over the last meeting, I got emotional over this, dude. I mean, without you, like, dude, we would have been dead. Like, my practice, my overhead was sky high because I did a lot of internal expansion, and then this hit, and we were just nosedived. Right, the end of March, we were doing 50K a week, and normally we do 150 to 180, right? And it's not just even the amount of money; it's the patients we're seeing, right? So we just dropped, and we touched base, and then you're like, "Hey, we can do this, and we can just switch it." So I was like, "Dude, whatever it is, I mean, we think alike, so just do whatever you have to do, just." Put it there. I don't care. The cost was, at that point, we were like, we can't really spend excess money because there's really no money to go.
Yep.
And then it's we got to let go of our staff. We got to just shut down. And my whole thing was, dude, I have a bunch of credit cards. I will charge them on my terminal and I'll get money. Whatever it takes, I have to keep this afloat. And we had an emergency meeting with the staff, and I told them that this is my plan. I'm not letting anybody go. I will cover all the payroll, cover all that stuff. I just need you guys to come to the office, social distance, go wherever you need to be, whatever corners, grab a phone, call the patients. Let's just figure something out. And then money came out, was there enough reserves? I'm like, I have $500,000 of credit lines. I will charge it. And the staff were like, dude, if you're willing to do that, we'll give you our cards too, whatever it takes. So I'm like, oh, damn, okay, I got a little bit of boost. And then that night we spoke with you, and you said you wanted to switch it around to emergency dentistry. And I'm like, dude, let's just do it. And the results, man, dude, I mean, I never worked so much on a Saturday, a Sunday. We had 300 new patients one of those months, right? Which is unheard of. We usually get 100, 110, the most.
In 2 months, we drove over 1,000 new patient phone calls to your practice.
Yeah, dude, it was just incredible. They were just where do we put all these patients? I was doing 20, 30, 40 extractions a day and root canals. And the thing was, it's not just keeping the money afloat, whatever. That's just a byproduct of service. So I don't want anyone to think hey, it's just money. No, the byproduct of helping these patients out. Unfortunately, a lot of offices were not equipped to treat emergencies, and we were. We had negative pressure vents. We had all this other stuff, UV filtration. I installed all that stuff just forward thinking, right? So to stay afloat.
Yep.
Whatever the CDC said, all right, fine. Let's get negative pressure vents, UV filtrations, PECO filters, all this other stuff, right? So we were treating patients were coming from 30, 40, 50 miles away. You know, someone wants to come from the like outskirts of New Jersey. I'm like, dude, we'll find you somebody. Like, dude, how'd you find us? Google. I'm like, seriously, the ads reach you that far? Yeah. And it was just like, you know, the story, you know, we say countless amount of lives, patients with facial swellings. But what hits me the most is a 7-year-old girl who came in. She first did a video consult with a pediatric dentist. She was told whatever, you know, I'm not going to get into that part. Came in to see us. Huge swollen face. We drained it, right? The father called us at 6:30 or 6:45 a.m. Like, my daughter's face is swollen. We called the hospital. Like, you have to let this patient in. The doctor called us, said, dude, he was upset with us. And we're like, we didn't do nothing. Like, we just helped drain it. Like, we're the second person to actually first person to physically see her, second person to see her, because she saw somebody up through a video consult. Like, the patient was about to die, a 7-year-old, right? That's just wrong, right? Yeah. And the pediatric dentist didn't want to see it because it was COVID, right? I get it, but we're Healthline. We signed up for this stuff. Like, and this is a passion of mine, to save people, right? I always said there's only 2 people who could cure someone from pain: a dentist and a surgeon. That's it. There's nobody else unless you take the medication, right? But you still need to see a dentist or a surgeon to get you out of pain. Yep. Right? And this is what I signed up for, and I'm happy to have met you, man. I mean, the implants are great, but this just changed my whole perspective on dentistry, because there's so many patients who are coming to us, and what I was just seeing a lot of wrongdoing in dentistry. And when I explain to the patient, right now, because of this, we're only going to treat the emergency, but when you come back, we can overall evaluate. And now, like, I don't have enough rooms in my practice to see all these patients. So it's just great, man. I mean, I can keep going on and on. It made me emotional, man. I mean, right now, dude, literally, we would have shut down and gone under.
Yeah.
So thank you, man.
I'm really glad we could pull through for you. And thank you so much for sharing that story, and just being raw and transparent.
Yeah.
So I'm going to share a little bit of math behind the marketing campaign. And that's amazing, by the way, that you could save that little girl. I had no idea about that. So
no, don't worry, dude. I mean, I'm happy, dude. I mean, it's just, I'm really glad to stay afloat. I mean, and dude, I forgot to even share the numbers. Like, you look at
real quick. So let's talk about the marketing spend. All right, so guys, I can just show a screenshot of his ad account right here. I'm not going to show you the actual ad or the URLs, things like that, just for privacy for him. But in terms of ad spend, so far we've spent a total of about $7,000. We've had over 1,151 conversions, over 1,000 new patient phone calls or form fill leads, and his cost per conversion from Google is $6.12. $6.12 for a new patient phone call. So we'll go back to the questions here, and go ahead and share with them the results you had from that total ad spend. How much revenue do you think you made during the pandemic?
Dude, so April, once the emergency stuff started hitting, like first week of April, because we started talking end of March, and first week of April we went live with it. We did 437 that month. Right? Insane. And then last month, May, we did 610. COVID, right? And this is all from extractions and root canals, or starting root canals, right? And extractions, right? And now those patients are coming back. Restrictions were lifted. This month we're so far, and it's only today's the 17th. Dude, I forgot what day it is. 16th or 17th?
17th, yeah.
We're at 532 or something like that. So insane, dude. It's just phenomenal. And all the patients who we treated during those times, they're coming back. They're like, I've never been treated this way. And it's the same way I treat every patient. Yep. But you just helped me get my voice out there. Like, you know, yep. We're 10Xers, you know, we followed Grant. It's just like, get attention. Yep. You help me yell, right? I'm a dentist. I know what I'm doing. This is what I want to do for you. You just help me get the market share.
Amazing. Yeah, exactly. Get the market share, go after it, be aggressive. You can't be afraid to spend money on marketing. It's just the reality of business. All right, Dr. Gandhi. So what would you tell the other dentists who are watching this video right now? They're either on Facebook or on YouTube. They're a little skeptical. Obviously, the results we've shared today are pretty phenomenal. They're extraordinary. And they might be struggling right now how you were at the beginning of COVID-19. They took a revenue hit. What would you tell those dentists who are kind of in that slump and they need to take proactive action to make sure they can recoup their revenue lost? What would you tell those dentists?
Yeah. Okay. So with emergency marketing or emergency dentists, that's a whole new avenue, and it's a market that I feel like it's untapped, right? So I'm still getting phone calls. So a lot of dental offices are open in Long Island or New York, right? But and we were one of the last states to open up. But I'm still getting phone calls. Just right before we got on this phone call, I had a call from someone in Brentwood, someone nearby who has an emergency. Yeah, they could have called somebody else, but because of the way you do your algorithms or whatever it is on the internet, we're still getting phone calls, and that's helping us boost. And it's not just them; they're telling all their other people, friends, family circle, like, hey, this dentist is open. They're willing to see me for the emergencies. Unfortunately, a lot of dentists are not equipped for emergencies, but if they are, you got to hop on this. It's an untapped potential just to increase the revenue.
And guys, there's essentially no risk. We're offering with 30 days free trial. 30 days free trial of the emergency marketing program, the exact program that brought Dr. Gandhi over 1,000 new patient phone calls.
Yeah, and I don't know what you said, how much I paid during the COVID-19 crisis, but I mean, dude, you take like our revenue was
$7,000, and you made over $500,000 in revenue. Like, yeah,
no, 1 million.
Oh yeah,
1 million in 2 months.
Because 500, 600. You're right. Yep.
Yeah. So holy cow. So that's, I don't know, 7% or whatever it is, man. That's like not even 7, dude. It's point. Yeah, it's like that little, and it's gonna generate something. And then if you do your other implants or your Invisalign or other stuff, patients will gravitate towards you then. And
can you describe that? Can you share that with them? I know that you turned back on your implant video marketing. Can you share with them how that additional program works? The video marketing on Facebook for dental implants. What is your experience with that?
Yeah, so the video marketing with implants. So basically, you get something to read from this paper. And as a dentist, I'm like, this makes no sense to me. Absolutely. Like reading this stuff, I'm like, I'm a dentist. I don't know how to read this, right? But when patients see those videos and the words, the keywords, whatever's said on those videos, the patients are like, I just gravitate towards you. I had that question in my head, but I didn't know how to ask it. Or my last provider or my current dentist couldn't answer that question for me. But yet the video did. And the thing is, it's a second sale, right? So you're helping the second sale. They already went to one patient, one doctor or dentist, and then they come to me. They're like, I already want to get it done. They're describing the procedure to me. It's the best thing ever. My consults have went from like 30, 45 minutes to 5 minutes, 10 minutes. Like I'm in and out. Like that's why I could do more consults now. Patient like, yeah, I want what I saw in the video. And I'm like, wait, which video? Yeah. Like, no, I want that denture that's just inside my mouth. I don't have to take it in and out. I already know how much it is. When can we start? Can we get it done by next week? I'm like, no, I don't have time. You know, it's like, we're going to get it done. But yeah, dude, it's just, you spend the time in the marketing, spend the money in the marketing, and it decreases my chair time explaining to a patient doing a consult because they're already pre-sold, which is great.
Amazing.
So, and more service. And I get to treat more patients. I love this stuff. Like I love implant dentistry. 10 years in, or you want to count 14 years with schooling. But I love it. Yeah. And to see the patient smile, come in, smile after smile, and just change their whole attitude, change their whole facial structure. Dude, I never cry. I gotta share this one story for you. If this is implant marketing, you can cut it and share it, whatever. I don't care. So I had a 19-year-old patient, emergency, right? She came in for emergency. And you guys see this case, phenomenal, right? So the mom called on a Sunday. I picked up the phone. She tried calling her dentist 3 times, didn't get an answer. I picked up, called in meds for her, just antibiotics over the phone to the pharmacy Sunday. She came in Monday. I ended up taking out 4 teeth on her. Her genetics, her whole teeth were bombed out. She needed all on 4, top and bottom. Implants, everything, right? I just finished the case. Dude, I never cried in the chair. Not really emotional, but dude, emotional because you helped save my business. You helped save every staff member from looking for another job. So to me, that's rewarding, right? And this patient, I never cried in the chair until I saw her teeth. 19 years old, who needed surgery. She would have never found me. The dentist she was going to she was hopeless. That's what she was deemed, hopeless. I'm like, no, there's a way around this. We can figure it out. And on top of that, she's Medicaid. State insurance, yet still paid for the procedure, all because of your emergency marketing, which I couldn't do And this leads back to emergency marketing. I couldn't do any of the work except emergencies where she was in pain, even though she had infections everywhere. So I only treated the infections. They said, when things change, we're going to start you on this process. And now she's nothing but smiles. And those photos I'll send you. You could definitely share those photos. She's phenomenal, dude. So
wow.
To me, that's just amazing, man. To do that to a 19-year-old and she has another 70, 80 years to live, it's just crazy.
You changed your life forever. She's going to have a totally different quality of life.
Yeah, and it came from, dude, and it all started from the emergency call. That's all it was. And I picked up the call, right? So if you're willing to do emergency marketing, be ready to pick up the phone call, right? So for the way I worked it out is I get the phone call, I triage it to 2 of my staff members. I send a text message to my staff members. They call the patient. They let me know what I need to do. Call in the script, or I need to call the patient. And then this way we have the whole circle. But I get notified for the phone call first, not because I want to control everything, but because I need to know, make sure the patient is taken care of. So if I get that phone call, I send it over, make sure the patient's seen, or if insurance, whatever, we don't accept it, that they find somebody to see. So this way everyone's treated really fair and well.
Amazing. Amazing. Well, I'm so happy we could pull through for you. Thank you so much for sharing this story. What would you tell the dentists who are watching this? What's the final statement you would say?
Dude, just do it, man. I mean, there's no way for potential growth that I've had in this whole field if it wasn't for Kiana. Your company has taken a big toll, like big help to push our practice to the next step, right? And we just started working with you, right? We just started.
Oh, it started off. It was a referral from your friend. We just started off.
Yeah, it's a referral. Yeah,
Dr.
Philman. In like January, right?
Yeah.
January.
Yeah.
And January, February, March was supposed to be one of our best months ever in this practice. January and February were insane. Give it a try. And if you're going to give it a try, the thing about this marketing step is when you give it a try, you start seeing the inflow within a week or 2. It's not like you have to wait. Like the mailers, we send it out and we have to wait 6 weeks, 8 weeks, 10 weeks. So you're losing all that. You're spending money, but you're not seeing anything come in. With this marketing, it's like, boom, it's there. It's live, and patients start clicking, and all of a sudden you start getting phone calls. So when you start doing that, you start seeing like, it worked. So spending the money for a month or 2 months is not going to hurt you. So I would say do it. Your company and you know what you're doing, and it's changed the way we are at the office. And the crazy part is the 2 new associates I'm interviewing, they're like, dude, and they went around office to office. They've been interviewing like crazy, because they want a job, right? Yeah. So I want full-time. I was like, if you want full-time, positions here. I don't want any part-time guys, right? So they're like, what are you doing? How are you doing this stuff? And he's like, how are all your patients just like, they come in like all rattled up, and then they love you guys. And they seen the patients who come in like all angry and pissed off. And then the week later, they're like, dude, what do you guys do? It's nothing. We're the same. We just talk to them. But how do you get that patient in through the door? How do you get your name out there? And this is the way. Like, I can't like scream loud enough. You've helped me scream way louder than I could scream. So, and get all the attention I need. So thank you.
Amazing.
And I thought, just do it. Give it a try. And you got nothing to lose.
Excellent. So if you're watching this, don't hold back. Click the link down below. Take advantage of the 30-day free trial. There's no risk. There's no contract, guys. We're going to give you the exact same emergency marketing program that helped our Jigar Gandhi survive COVID-19. Like he said, he made over $1 million in revenue on this exact program. Just take advantage of it. If there's ever been an opportunity for you to have a strong comeback, this is it. Click the link down below. You have to help yourself in order to recoup that lost revenue. All right. Thank you so much for hopping on the show. Thank you for sharing your story. Keep
You're welcome, man.
it. All right.
Thanks, brother. Thank you, man. Appreciate you. Thanks, buddy. Bye.